Episode 3: Understanding the Severity of Addiction. Like other chronic illnesses, addiction tends to get worse over time. Similar to the stages of cancer, doctors can measure the severity of an addiction to help determine the right kind of treatment. A few years ago, doctors released new guidelines for diagnosing substance use disorders, or SUDs. They included 3 levels of severity. Level 1 is a mild substance use disorder. Level 2 is moderate. And level 3 is high, also known as an addiction. People who use alcohol or drugs in risky ways but aren't yet experiencing a full disorder are considered at risk and placed at level 0.5. Knowing the severity level of your substance use disorder helps your doctor understand the status of your illness and your risk for serious events, like overdose. It also helps your doctor understand how your disorder is likely to progress if left untreated, and then plan the best course of treatment. Doctors determine the severity of a substance use disorder based on 3 categories of symptoms. The first category of symptoms relate to how much control you have over your substance use, such as using more of a substance or using more often than you mean to, and wanting to cut down or stop using but not being able to. The second category of symptoms relate to how your substance use affects your life, such as neglecting your responsibilities and relationships, or giving up activities you used to care about because of your substance use. And the third category of symptoms relate to your level of physical dependence on the substance, such as needing more of the substance to get the same effect, also known as tolerance, or having withdrawal symptoms when you don't use. As a substance use disorder progresses, your chances of having mental and physical health problems goes up, and overall quality of life goes down. And most importantly, the risk of death increases with severity. Starting treatment as soon as possible is key. The more severe the disorder, the more intense the level of treatment is needed. As you move through treatment, you should step down to less intensive levels of care. If you have a severe substance use disorder, you may start with inpatient services, then graduate down to intensive outpatient care. Whereas if you have a moderate or mild substance use disorder, you may start with outpatient care. Your doctor should monitor your progress and adjust your treatment as needed. If you experience a setback, you may need to go back up a step. It's important to remember that more treatment isn't necessarily better if it's the wrong kind. This is why understanding severity is so important. If you think you or a loved one may have a substance use disorder, don't wait to find help. The sooner you're treated, the better your chances for a full recovery. Reach out for help today.